We found in the study by Lafton's group that the group of odontogenic cysts and tumors followed by inflammatory and reactive lesions and in the study by Ley, the group of inflammatory and reactive lesions was the more prevalent, followed by tumor lesions and cystic lesions. With respect about age groups and sex of patients with head and neck, regarding sex, the male-female ratio was 2:1, and men presented 66.42% of the pathologies evaluated, and women 33%. There was not a significant relationship between sex and frequency of the pathologies. And these relationships was consistent with other studies, such as the Danutai et al. Regarding the relationships between age and sex, the age group with the highest frequency of head and neck pathologies in both men and women was of the 10 to 14 years of age. Also, there was no significant difference between the age groups regarding the presence of the pathologies with respect to sex. On the other hand, the relationship between sex and diagnosis of head and neck pathologies occur with a frequency of 32. The infection lesions occur with a frequency of 32.8 in women and 67.2 in men. Was the most important thing that we found in this. In the category of odontogenic tumors, the percentage frequency in women was 34.3%, whereas in men it was 65.7%. And those two categories of pathologies were the most frequent in both women and men. With respect to the relationship between age with diagnosis of head and neck pathology, regarding to the age, we found that the highest frequency of head and neck pathologies reported by the Department of the Pathology was 10 to 14 years age group, with a percentage of 31.5, followed by patients aged 0 to 4 years, with a frequency of 26.35. Like I mentioned, the age group that present the highest frequency of head and neck pathologies was the 10 to 14 years age group, with a percentage of 31. Although the different studies don't have the same division of the age group as the present study, it was observed that most of the pathologies occur in patient age 11 to 15 years. According to the relationship between the disease and its anatomical location, a statistical significant association was found between the pathologies and their location. And we can see head and neck cystic lesions was found with more prevalence in TMJ and neck, and oral and cavity and soft tissues. TMJ lesions in the TMJ and neck, infection lesions in nasal cavity, skin lesions in TMJ and neck, a head and neck benign tumor in oral cavity and soft tissues, head and neck malignant tumor in nasal cavity, and these evidence are these associations are evidence in other studies, such as that of Leyer. With respect about the relationship between disease and presence of pain, in the present study, we evaluated the presence of pain and paresthesia of the 2,077 patients and 142 report pain. However, 87 had infection lesions, and according to the Pearson square test, there is a statistical significant association between the presented pathology and the presence of pain. As for the patients who presented paresthesia, the most frequent pathology was the benign tumor, odontogenic tumor, representing 14 of the total. And the fact that the health system is not efficient and pathologies are diagnosed and treated when they already are presenting maybe is a reason for these results. Our conclusions is that the most frequent head and neck pathologies that occur in patients were infection lesions, followed by benign odontogenic tumors and benign head and neck tumors. As for sex, the male-female ratio was 2:1, and the age group that present the highest frequency of head and neck pathologies was 10 to 14 years, followed by age 0 to 4 years. In all age groups, infection lesions have the highest percentage of frequency, and benign head and neck tumors occur more frequently in the 0 to 4 years. The most frequent locations was head and neck cystic lesions in the TMJ and neck, TMJ lesions in the TMJ and neck region, infection lesions in nasal cavity, skin lesions in TMJ and neck, benign head and neck tumors in the oral cavity, benign odontogenic tumors in posterior mandibular area, and malignant head and neck tumors in the nasal cavity. Statistical significant association between the pathology and the location of the lesion and the signs and symptoms of pain and paresthesia.
ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ಕೊಟ್ಟಿಲ್ಲ ಅಂತ ಹೇಳ್ತಾರೆ. ಅಲ್ಲಿ ಯಾರು ಇಲ್ಲ ಅಂತ
Sorry for interruption, Erika, but other presenters or other audience, could you please put your mic muted, please? Dr. Vina, could you please mute your mic?
And the recommendations of our work is that we need to unify the methodological criteria, limit the age variable, adapt ourselves to the ICD-10 codes, this study can be a national epidemiological benchmark, and then maybe can conduct similar studies in hospitals that treat this type of pathologies.
Is there any question from the audience to Dr. Erika?